The emergency room at Memorial Hospital was in chaos that winter night. The wind howled outside as ambulances arrived one after another, bringing victims of a multi-vehicle accident on the interstate. Fluorescent lights flickered above the stretchers as doctors shouted orders and nurses scurried back and forth with equipment and medications. Sarah Mitchell was only 23 years old and had graduated from nursing school just 6 weeks ago. Her fingers trembled slightly as she checked the vital signs of an elderly patient who had been brought in with a suspected heart attack. She could feel the older doctor's stares on her, that silent weight of judgment that seemed to follow her since her first day at the hospital. Dr. Harrison, a cardiovascular surgeon with over 30 years of experience, walked past her without even glancing at her. She heard him mutter something to the head nurse about incompetent newbies, and felt her face flush. It wasn't the first time she'd heard such comments. Ever since she started, it seemed like every tiny mistake was magnified. Every hesitation was a reason for criticism. The truth was that Sarah didn't fit the typical profile of nurses at Memorial. She was small, looked even younger than she actually was, and had a soft voice that was often drowned out by the constant noise of the emergency department. The other members of the medical team, especially the older doctors, seemed to see her as a child playing nurse, not as a capable professional. But Sarah had something they couldn't see at first glance. She had a determination forged by years caring for her Vietnam War veteran grandfather, who had died of cancer when she was 17. It was by his side, seeing the attentive care of the hospice nurses, that she decided to pursue this career. She knew what it truly meant to care for someone, especially those who had served their country. That particular night, around 11 o'clock, the automatic doors of the emergency room opened abruptly. 2 paramedics rushed in, pushing a stretcher on which lay a man in camouflage military uniform. Blood covered his shoulder and chest, and his face was pale but conscious, his jaw clenched against the pain. Dr. Harrison approached immediately, assessing the patient with experienced eyes. The head nurse, Margaret, a robust woman in her 50s, began preparing the trauma room. Sarah stood beside her, awaiting instructions, her heart racing not only from the emergency, but from the painful familiarity of the scene. The uniform, the medals on the man's chest, everything reminded her of her grandfather. The soldier was about 35 years old, with dark, closely cropped hair, and even amidst the obvious pain, his blue eyes remained alert and focused. There was something about his posture, even lying wounded, that commanded respect. Later, Sarah would discover that he was Captain David Reynolds, a Navy SEAL who had been wounded during a training exercise gone wrong. Dr. Harrison began examining the wound while giving quick orders. Captain Reynolds had been shot in the upper shoulder, dangerously close to the subclavian artery. It was serious, but stable for the moment. As the medical team moved around him with practiced efficiency, Sarah noticed something the others seemed to have missed. The captain's breathing was slightly irregular, not just from the pain, but there was something more. She recognized that pattern. She had seen it before. Her grandfather used to have silent panic attacks when he was in hospitals, flashbacks of his wartime experiences triggered by the clinical smells, the bright lights, the noise. Sarah stepped forward against her instinct to remain invisible and out of the way. "Captain Reynolds," she said softly, leaning in slightly so that only he could hear her clearly above the chaos around them. "I know this is difficult. Breathe with me, okay? Inhale through your nose, count to 4. Hold. Exhale through your mouth, count to 6. The captain's eyes locked on her, and for a moment, something passed between them. Recognition, perhaps, or gratitude. He followed her instructions, his breathing beginning to steady. Sarah gently placed her hand on his uninjured arm, a firm but comforting touch, just as she used to do with her grandfather. Dr. Harrison turned abruptly. "Mitchell, nobody asked for your help here. Keep your distance and let the professionals do their job." Head nurse Margaret looked at Sarah, with an expression that mixed irritation and something close to pity. "Sarah, dear, why don't you go check on the patients in the hallway? We'll take care of things here." Sarah felt the familiar wave of humiliation wash over her. She nodded, preparing to back away, but then something extraordinary happened. Captain Reynolds, even through the pain and trauma, raised his good hand and gently grasped Sarah's wrist before she could turn away. "Wait," he said, his voice hoarse but firm. "She'll stay. She understands." Dr. Harrison frowned, clearly annoyed by a patient dictating who should or shouldn't treat him. "With all due respect, Captain, Miss Mitchell is far too inexperienced for this type of case. She just graduated from school. I don't care about her experience, Reynolds replied, his eyes never leaving Sarah's face. She's the only one here who's seen more than just a wound. She saw me. She stays, or I get up and leave right now, gunshot wound or not. There was a moment of stunned silence in the emergency room. Nurses exchanged glances. Dr. Harrison looked about to argue, but Margaret intervened with a sigh. It's all right, Captain. Sarah can stay, but she'll just observe and help when asked. Sarah felt her eyes sting with unshed tears, but she blinked rapidly, forcing herself to maintain her composure. She stood by the captain's side as the team worked to stabilize him, clean the wound, and prepare him for surgery. Throughout the process, she maintained that calm presence, occasionally reminding him to breathe, offering reassuring words when she saw his jaw clench against waves of pain. Before being taken to the operating room, Captain Reynolds did something no one expected. With great effort, he raised his good hand in a precise military salute, directed straight at Sarah. It was a gesture of profound respect, the kind a soldier gives only to those he considers worthy, those who truly understand sacrifice and service. Sarah, without thinking, without caring who was watching, returned the greeting as best she could, placing her hand over her heart in a gesture of recognition and gratitude. Tears finally escaped her eyes, but she didn't wipe them away. There was no shame in them. The room fell into absolute silence for those few seconds. Dr. Harrison stood still, his scalpel still in his hand, looking at the scene with an expression Sarah had never seen on his face before. Confusion, perhaps, or perhaps, just perhaps, the beginning of some understanding. Margaret, the head nurse, cleared her throat noisily. Okay, let's take him upstairs. Sarah, you're coming with us. I'll need you in the operating room. This was unprecedented. Novice nurses were rarely allowed in surgeries, especially complicated ones like this one promised to be. But Margaret had seen something in that exchange, something that made her question her own judgments about the young nurse she had dismissed so easily. The following hours were the most intense of Sarah's professional life up to that point. She observed, learned, and when asked, assisted with a precision and care that surprised even the most skeptical surgeons. Dr. Harrison, to his credit, began to give her more significant tasks as the surgery progressed, noticing that her hands did not tremble, that her concentration never wavered. The surgery was a success. The gunshot wound had missed the artery by millimeters, and although there was significant muscle damage, no permanent damage was expected. Captain Reynolds would be able to return to active duty after months of physical therapy. When they finally finished, it was already past 3 a.m. Sarah was exhausted. Every muscle in her body ached, but she had never felt more alive, more certain that she was exactly where she was supposed to be. Dr. Harrison found her in the break room later, while she was drinking cold coffee from a paper cup. He sat heavily in a chair beside her, suddenly looking much older and more tired than his 5 decades suggested. I owe you an apology, he said bluntly. I judged you without knowing you, without seeing what you truly brought to this job, what you did there, recognizing his post-traumatic stress before it became a problem. That was exceptional nursing work. It's the kind of thing that no amount of technical experience can teach. Sarah looked at him, surprised. She hadn't expected this, especially not from him. My grandfather was a veteran, she said, calmly. He suffered with it for years. I learned to recognize the signs, the ways it manifests differently in different people. When I saw Captain Reynolds, I knew. Dr. Harrison nodded slowly. Knowledge born of personal experience. It's valuable, Mitchell. Don't let anyone make you think otherwise. You have something here, he touched his own chest, that goes beyond technique. This is genuine empathy, and it's rare. They sat in silence for a moment, 2 professionals at very different points in their careers, temporarily united by a shared understanding of the complexity of human care. In the days that followed, the story of what had happened that night spread throughout the hospital. The details were embellished and exaggerated in the retelling, as always happens, but the essence remained true. The rookie nurse, whom everyone had underestimated, had done something remarkable. She had seen beyond the physical injury to recognize the psychological wound, and in doing so, had earned the respect of a Navy SEAL. Sarah was assigned as Captain Reynolds' primary nurse during his recovery in the hospital. In the days that followed, they talked a lot. He told her about his years in the service, the missions he could never fully describe, the weight of leading men in impossible situations. She shared about her grandfather, about how his death had shaped her decision to become a nurse, about her desire to make a difference in small but significant ways. Reynolds quickly realized that Sarah had a gift. She didn't just administer medications and check vital signs. She truly saw her patients, especially the veterans who came through that hospital. She knew when to sit and listen, when to offer distraction, when to simply be present in silence. It was a skill that couldn't be taught in any nursing program. One afternoon, about a week after the surgery, Reynolds was sitting on his hospital bed, working through light physical exercises with his injured arm. Sarah went in to check on him and found him looking out the window, a distant expression on his face. "Are you okay?" she asked, pulling a chair closer to the bed. He turned to her with a half smile. "Just thinking about that night, about what you did. You saved more than you realized, Sarah." She shook her head modestly. "I just did my job." "No," Reynolds insisted, his voice growing more serious. "You did more than that. Do you know how many times I've been in hospitals? How many times doctors and nurses have looked at me and seen just another wounded soldier, just another case to process? You saw me as a person. You saw what was going on in my head, not just in my body. That matters more than you can imagine." Sarah felt that familiar burning in her eyes. "I know what it's like," she said softly, "to see someone you love suffer and feel powerless to help. When my grandfather was dying, the nurses who really made a difference weren't the ones who were technically perfect. They were the ones who sat with him at 3 a.m. when the nightmares came, who weren't bothered when he confused the hospital with somewhere in Vietnam. They were the ones who saw him, really saw him. I wanted to be that kind of nurse." Reynolds reached out and gently squeezed her hand. "You already are, girl. You already are." Reynolds' recovery progressed well. Each day, he regained more strength and mobility in his shoulder. But something else was happening as well. His presence in the hospital, and more specifically his vocal defense of Sarah, was changing how others viewed her. Other veteran patients began specifically asking for her. Word spread through the local military community about the young nurse at the memorial, who truly understood, who treated veterans not just as patients, but as the heroes they were. Families began thanking her with an intensity that surprised and humbled her. Dr. Harrison, true to his word, began to defend Sarah as well. In team meetings, he pointed to her ability to connect with difficult patients, her intuition for recognizing problems before they became critical. Slowly, incrementally, attitudes toward her began to change. But not everyone was happy with the change. Some older nurses resented what they saw as special treatment. Dr. Simmons, one of Harrison's colleagues, argued that Sarah was being promoted based on a single incident, not on consistent ability. Margaret, the head nurse, found herself in the unusual position of having to defend her newest recruit. In a particularly tense administrative meeting, she slammed her hand on the table. "You want to talk about consistency? Sarah Mitchell has the lowest patient complaint rate of any nurse on this floor. She has 0 medication errors. 0. And her patients recover faster, have smoother discharges, and return to the emergency room less often. These are facts, not feelings." The numbers didn't lie. Sarah was objectively doing an exceptional job, but it was harder for some to accept because it challenged their assumptions about what made a good nurse. They expected years of experience, boisterous confidence, the ability to dominate a room. Sarah offered something different, something quieter, but equally powerful. 2 weeks after his surgery, Captain Reynolds was ready to be discharged. On the morning of his departure, Sarah entered his room to do final checks and review his post-operative instructions. She found him already dressed in civilian clothes, a small bag at his feet. "Ready to get rid of me," he joked, but his eyes were serious. Sarah smiled. "You've been one of the easiest patients I've ever had. No complaints about the hospital food, always did your exercises, never rang the call bell in the middle of the night unless absolutely necessary." "Well, I had a good nurse." He hesitated, then pulled something from his pocket. "Sarah, I want you to have this." It was a challenge coin, a small, round object used by the military to symbolize unity and respect. This particular one had the Navy SEALs emblem engraved on one side and something written on the other. Sarah turned it over, reading the engraved words. "Courage is not the absence of fear, but the willingness to face it." She looked up, confused. "This coin was given to me by my commander after my first mission," Reynolds explained. "It accompanied me through 3 deployments, countless operations. Moments when I thought I wouldn't survive. Now, I want you to have it. Sarah began to protest. Captain, I can't accept this. This is yours. It's part of your history. And now it's part of my story that I've given to you, he said firmly. Sarah, you reminded me of something that's easy to forget in this line of work, both mine and yours. That sometimes the bravest thing you can do is simply show up, see someone in their vulnerability, and not look away. You did that for me. This coin is to remind you that you have that kind of courage. Tears streamed freely down Sarah's face now. She closed her fingers around the coin, feeling its weight, its significance. Thank you, she whispered. This means more than you know. No, Reynolds said softly. Thank you for seeing me, for caring enough to actually see. They embraced quickly, that brief but sincere hug of two people whose lives had intersected at a critical moment and were changed by it. Then Reynolds picked up his bag, gave Sarah one last greeting, and walked out the door. Sarah stood in the empty room for a long moment, clutching the coin to her chest. She knew that this moment, this patient, this experience had fundamentally changed something within her. She was no longer the shy, insecure rookie nurse who feared her own judgment. She was someone who had been seen, validated, recognized by someone who truly understood the meaning of service and sacrifice. In the months that followed, Sarah kept the coin in her pocket every day during her shift. In moments when she doubted herself, when she made a mistake or faced criticism, she would touch the coin, feel its weight, and remember that someone believed in her enough to give her one of their most precious possessions. The story of Sarah and Captain Reynolds continued to resonate throughout the hospital. She became something of a legend, especially among younger nurses who felt undervalued or ignored. They began to come to Sarah, asking for advice, seeking guidance. She always received them with the same kindness and attention she had shown. The captain. A year after that fateful night, Sarah was appointed to lead a new initiative at the hospital, a program specifically designed to improve care for veterans and active duty service members. It was an enormous responsibility, especially for someone with so little formal experience, but no one questioned the choice. She had proven not only her technical competence, but something rarer and more valuable, her ability to connect, to heal not only bodies, but also spirits. At the ceremony, where the program was officially launched, Dr. Harrison gave the opening address. "A year ago," he began, "I was ready to dismiss a young nurse as incompetent based solely on her age and appearance. I was wrong, profoundly wrong. Sarah Mitchell taught us all, that true excellence in healthcare doesn't come just from technical knowledge or years of experience. It comes from something much deeper, the ability to see our patients not as cases or conditions, but as complete human beings, with stories, fears, and hopes. She brought that vision to every interaction, and in doing so, made us all better professionals." Sarah stood to the side, the challenge coin in her pocket, tears of gratitude and humility silently rolling down her face. She thought of her grandfather, wishing he could see this moment. She thought of Captain Reynolds, wondering where he was now, hoping he was safe and sound. And she thought of all the patients she would still meet, all the lives she would still touch. The greeting Reynolds had given her that night had been more than just a gesture of respect. It had been an acknowledgement, a passing of the torch from one servant to another. He had seen in her the same commitment to service that he carried, only manifested in a different way. And by recognizing her in this way, he had given her the confidence to finally recognize it in herself. Sarah Mitchell was not just a good nurse. She was a guardian, a healer in the deepest sense of the word, and she was only beginning her journey.